What are the risks of occupational dusts and inadequate PPE for COPD? Imagine working in a place where tiny particles fill the air, and you might not even notice how much you're breathing in. That's what happens in many jobs where dust and fumes are common. Occupational dusts like mineral dust, organic dust, silica, coal dust, and fumes can cause serious lung problems over time. When workers are exposed to these dusts regularly, their chances of developing chronic obstructive pulmonary disease increase significantly. In fact, they are about 1.5 times more likely to get COPD than people who aren't exposed. This risk stays the same whether someone smokes or not, which shows dust exposure alone can cause damage. These tiny particles irritate the airways and harm lung tissue, leading to inflammation and narrowing of the air passages. This damage makes it harder to breathe and can cause symptoms like coughing, wheezing, and shortness of breath. Now, if workers don't wear proper personal protective equipment, or PPE, the risk gets even higher. PPE like masks or respirators are designed to filter out harmful dust particles before they reach your lungs. Without these protections, dust particles are inhaled more deeply and in larger amounts. This increases lung irritation and speeds up the decline in lung function. For example, a simple mask that covers the nose and mouth can block many of these particles, but only if it fits well and is used consistently. When workers skip using PPE, they expose their lungs to more irritants, which can worsen existing COPD or even cause it in the first place. Certain jobs are more prone to dust exposure. Construction work, mining, farming, manufacturing, and jobs involving handling materials like grain or pesticides are common examples. These jobs often involve substances like cotton dust, grain dust, welding fumes, diesel exhaust, and pesticides. All of these irritants can cause inflammation in the lungs, making COPD more likely or more severe. Preventing these risks involves more than just wearing PPE. It includes using masks or respirators properly, making sure workplaces have good ventilation, and reducing dust generation wherever possible. Regular health checks for workers can catch early signs of lung problems before they become serious. In the end, protecting workers from occupational dusts and ensuring they wear the right PPE is key to preventing COPD. When dust is kept under control and proper equipment is used, the chances of developing or worsening this disease drop significantly. Keeping lungs healthy is a team effort that involves safety measures, awareness, and consistent use of protective gear.